Doc is going to show us some of the tools of his trades spread out on an operating room towel on the back table here. Lon, explain some of the instruments that you have in front of us, in front of you,
Yes.
and how you use them.
So we talked a little bit about the entry. So all the thermal procedure needs an entry. And our entry is really just a needle stick, nothing more than that. So this first one is the catheter, basically like an IV catheter that you put into the vein. We use the ultrasound guided, like I showed the needle before, guide the catheter into the vein. And then through that catheter, we put the different fibers. So this one is the radio frequency fiber. This is the one that uses radio waves. I'm going to see if you can see that. Radio waves to heat the vein. So basically, the catheter would be in the vein, and then we would thread the fiber through there. So actually, we take that out, and then we put the fiber through there, and it goes into the vein.
And how long do you leave it there?
We actually leave it just 7 seconds at a time.
Okay.
So just 7 seconds to heat the vein, and then we move. And this is a laser fiber. I don't know if you can actually see the fiber, but it looks like a fiber optic Christmas tree fiber. And it does the same thing too. It basically goes into the catheter too. And as we go up to the top.
Are they all equally effective? Do you pick one over the other?
That's actually a great question. They actually are almost equally effective. They are generally about 90 to 95% effective. How we choose them actually depends on the size of the vein, how tortuous or how curvy the vein is. Also,
The fiber optic being
also,
more
unfortunately, one of the decisions we have to make is what your insurance company will cover, because different insurance company will cover different procedures. But the good news is that they are all pretty much equal.
Right.
We actually use every single one of these on here. We use the radio frequency, the laser ablation. We also use the glue, the venous seal, and the foam injection. So we use all those procedures, and they actually work just as good, all of them.